Meet the Smiths, a family of four living in the suburbs of Toronto. They lived a peaceful life until their youngest child, 4-year-old Sarah, was diagnosed with cancer. Overnight, they went from a typical family to fierce caregivers. Parents like the Smiths face a daunting journey. They shoulder the weight of their child's pain and fear. They themselves are uncertain for the future and bear increased responsibilities in caring for their ill child. Unfortunately, this is the sad reality faced by the parents of the 300,000 children diagnosed with cancer each year. The result? The statistics paint a stark picture. 40% of fathers and 50% of mothers face a diagnosis of acute stress disorder. Anxiety affects 21% of parents. Post-traumatic stress disorder? It's a reality for 1 in 5 families. We are left to wonder, is there anything we can do to help these parents? There is hope on the horizon. In 2022, Kimberly Cantor and her dedicated research team embarked on a groundbreaking mission. They knew electronic health interventions, which are services accessed through the internet, mobile phones, and computers, were profound in helping to better the mental health of family members of adult cancer patients. But could this help parents of pediatric cancer patients? They set out to test the electronic surviving cancer competently intervention, better known as eSkip. Cantor's research team recruited 19 parents, courageous warriors caring for children ages 0 to 17 battling cancer. Each bravely filled out questionnaires measuring acute distress, post-traumatic stress, anxiety, and family functioning. They then tested eSkip, a beacon of hope based on both family systems and cognitive behavioral theory, emphasizing that effective mental health support relies on the collective effort of social communities surrounding the affected individual. They then powered through 4 modules teaching them how to manage negative emotions and measured signs of acute distress, post-traumatic stress, anxiety, and family functioning once more. What was discovered? A testament of hope. Experiences of acute distress were found to be significantly reduced, with effects being large. Post-traumatic stress and anxiety were also reduced, with effects being moderate. Parents also testified to the utility of eSkip. Overall, the intervention was found to have high acceptability and feasibility. I learned something new from eSkip, said one parent. eSkip will help both me and my child. I would recommend eSkip to other families, said others. So parents, what's in it for you? Poor mental health has been found to contribute to decreased quality of life, reduced physical health, and poor sleep, all of which may lead to challenges in caring for your ill child. This intervention, therefore, has the potential to help you both. Healthcare professionals, consider advocating for eSkip implementation. The electronic nature of eSkip can help parents access interventions to better their mental health, as 12.3% of parents report inconvenient service times and 8.7% report inconvenient locations as barriers to accessing this much-needed support. Support from well-educated and trusted individuals such as yourselves will be monumental in implementing eSkip. Lastly, policymakers and funders. We would like to remind you how an intervention such as eSkip will not only benefit parents of children with cancer, but there's perks in it for you too. Approving an intervention such as eSkip, which is electronic in nature, means there are less associated costs to implement the intervention, less required space within clinical environments such as hospitals and doctors' offices, and the need for less medical personnel to administer the intervention. It can also be considered an alternative intervention in resource-poor communities, ensuring all parents can access the support they rightfully deserve, making this intervention a reality for countless families. In conclusion, eSkip is not just an intervention. It's a beacon of hope for parents and families caught in the storm of childhood cancer. It's a call to action for all of us, parents, healthcare providers, policymakers, and funders. Let's unite to support these unsung heroes, to lift the burden of distress off parents and make their journeys a little brighter. Together, we can rewrite the story of childhood cancer, one family at a time, and make these findings a reality for families all around the world. Thank you.